Joining me today, I have the president and CEO of the Manitoba Lung Association joining me, Juliette Mucha. Thank you so much for taking the time.
Well, thanks for having me.
Absolutely. So just to start off, if somebody doesn't know what the Manitoba Lung Association is or offers, let's get into that.
Manitoba Lung Association is the hub of information for all Manitobans relating to your lung health. Formerly, some people would have known us. We've been around for 120 years, but people would have known us as the Sanatorium Board of Manitoba, where we oversaw and cared for patients with tuberculosis. So it has since been changed, and we don't provide any frontline care. That is all with the province and with the WRHA. But we provide education. We are a not-for-profit, so we actually collect monies. We provide ongoing research to local researchers to provide just evidence-based programming and supports. We provide as well some support groups for people with lung cancer. We provide with long COVID. We have pulmonary fibrosis and the lung transplant support groups. And we also fund research. We also fund education to be able to help support our young students who are coming in Manitoba, to be able to help support them and everything regarding nicotine cessation, to help people with their quit smoking journey and to provide evidence-based supports regarding vaping.
Absolutely incredible. I love it. Thank you for sharing that. I didn't know half of that, at least, so great. With all these wildfires that Manitoba has been having, whenever there's an air quality warning, what does that really mean for Manitobans?
That is the one instinct that Manitobans should actually check online. What does that mean for them to consider for their lung health? We saw last week, and wildfires are becoming a lot more predominant this year, a lot earlier in the season as well. So what does that mean? I remember one morning last week, I woke up, we all smelled smoke. So I have it bookmarked on my phone. I checked the Air Quality Health Index right from the Manitoba Lung website. And that gives you right away in my area, what is the reading? There was one day the reading was up to 6. So that means to take precautions, take measures. And that means different things, but that just means, especially with the winds that we had, those fine particles that are being released from the wildfire smoke are traveling through the air. We are all susceptible. We all need to take precaution to make sure that we have long-term support for our lung health.
Amazing information. And what might be some of those precautions people can take?
Yeah, so on a day that it might be a little elevated, even if for a healthy person as well who doesn't have chronic lung issues, maybe on those days, maybe instead of running outside or cycling outside, go to the gym or just run inside. You know what? Close your windows and just put the AC on. Make sure you have a HEPA filter if you have an air purifier. Fresh air intake if you're in your car. Maybe put the recirculation air button, which a lot of people don't realize what it does. Wear an N95 mask if you do have chronic lung issues as well. But the biggest thing as well, and then if you don't have AC, maybe go check out your local library or shopping center and just be able to help keep your lungs safe in that capacity, because there's a lot of evidences that give you some tips right away, such as if you suddenly have watery eyes, your chronic cough, your nose is running, just making sure a little pressure on your chest, just taking those precautions. And for those who have chronic lung issues, with what we've seen in Manitoba with the constant wildfire smokes coming up, have a little first aid kit ready. That could be if you have asthma, maybe have your puffer, a spare puffer, have some water. Water can be a great support to keep the inflammation down in your lungs as well. Having some of your medications ready as well. And maybe just having a phone number and work with your doctor, your pharmacist. They can help you get that ready for you.
It's important when we've had so much air quality issues. Who are people that are more likely to be affected by air quality warnings?
Yeah, so obviously we have a vulnerable community with our seniors and anyone who has chronic lung disease, such as those with asthma, pulmonary fibrosis, COPD, those who already smoke as well. Just making sure that they're staying safe as well. So what can people do? Just check out the Manitoba Lung website, and we can be there to check your air quality health index, which is basically a measure to be able to make sure that you're getting accurate readings in your area.
What is the reading today for Winnipeg?
Well, luckily this morning it's a 1. So let's hope it can stay to that. But there's a couple of other areas in the province that are at 2s and 3s. So we need to make sure they're safe, especially our frontline workers who are the firefighters and the volunteers in those smoky areas, making sure they are safe as well, because of course we need them for obviously the ongoing wildfire fight that they are chronically doing for us.
Absolutely. Is there anything else you'd like to share today, Juliette?
I would just encourage everyone, go to your phones, go check out the Manitoba Lung Association website, go to the air quality page and bookmark it. Educate yourself because, of course, when things like this happen, it's on an emergency basis. So let's be prepared and informed ahead of time.
Fantastic. Thank you so much for joining me today and sharing this.
Thanks for having me.